Hi, my name is Shayla Weaver, and this is my experience with fibroids. I was in my last year of nursing school, and I was at a routine gynecological visit for my pap smear and pelvic exam when the gynecologist stops and says, "Your uterus feels firm." And I thought, what does that mean? So he immediately had me get off of the table. We went next door and we did an ultrasound. And that's when he told me, "You have a fibroid in your uterus." And at the time, it was small. So I thought, okay, well, what do we do about it? And he said that we should try either doing an implant where they would put it into my arm or insert an IUD, because he thought that at the time, me being on birth control pills may have been contributing to the fibroid. Well, I was not ready to make that decision. It was just too much information at one time. I was overwhelmed. So after the appointment, I called my mom on the phone because I knew she had history with fibroids. And I told her what happened, and she and I both agreed that, if I wasn't having any issues at the time with symptoms, then, just we'll cross that bridge when we get to it. Well, fast forward to less than a year later, I developed these excruciating, intense pains in my stomach that would just hit me out of nowhere. One day I was walking outside in St. Augustine with my family when the pain just hit me, and it almost brought me down to my knees. At that time, I had to sit on a bench and just wait until that pain went over. Another incident occurred when I was on a girls' trip in Las Vegas. We're all having a good time, and then all of a sudden they hear me yelling, and they walk in to see me slumped over in one of the hotel rooms. And they're all looking around at me and wondering what's going on. And that's when I had to tell them, I have fibroids, and they caused me to have these intense pains that come out of nowhere. And that's when I really knew I probably needed to go back to the gynecologist. So I decided to see another gynecologist that I was referred to by a friend who had been suffering with fibroids as well. I got there, I had a repeat ultrasound done, and to my surprise, this fibroid that I learned about less than a year ago had tripled in size. I mean, to the size of a grapefruit. And, I'm thinking, how did this thing grow so fast? And, I've noticed that my stomach was getting bigger, and I noticed that I looked more bloated. But I thought, maybe you need to cut back on all the sweets and salty foods. So I changed my diet. I started exercising more, and I just could not get rid of this, big belly. And the gynecologist at the time said my uterus was like the size of a 4th-month pregnancy. So I'm thinking, so what do we do about this? I'm having these pains, and I've never had a child before, but if I could imagine what labor feels like, these pains felt like I was in labor. So she went over some treatment options with me, and she recommended that we do an operation called an abdominal myomectomy, where they literally will cut you open at your stomach like a C-section. And she would remove the fibroid, and she explained to me that any other fibroids that were in there, she would remove those as well. And, my symptoms should be better. So I proceeded to go along with the surgery. It was a very rough recovery, I will say that. I was out of work for 8 weeks, and even after returning back to work, I was put on light duty as a nurse working on a very busy floor in the hospital. My core was extremely weak. It was just a really, really rough road to recovery. Now, what I did appreciate was that my stomach was back flat again. I was feeling more comfortable, more confident. I was able to get in those tight dresses that I had once stopped wearing because I was so self-conscious about my stomach. And things were pretty good for the next 3 years. Well, 3 years later after the surgery, I started developing these really heavy cycles. At the time I had switched to an IUD because I thought that would maybe slow down the growth of the fibroids and, I would be okay. Once I got the IUD in, my cycles were just so irregular. They would come on whenever they wanted to. I always had to have tampons or pads in my purses at all times. And what I think was a breaking point for me was when my husband and I went on our honeymoon, and the 3rd day of our honeymoon, I'm starting my cycle again. I just thought, oh my gosh, like we prepared for this special moment, and here I am bleeding again during the time that he and I should be enjoying ourselves. And, I was just so distraught about that. Called my gynecologist once I got back from my honeymoon. I said, hey, I don't know what's going on. The IUD, we got it put in there. I've been, trying to see if it will work, and I'm still having these irregular cycles. I'm bleeding, 3 weeks out of a month. So what else can we do? Because I can't live like this. So I decided to have the IUD taken out and to get back onto birth control pills. Well, things just intensified. I started having these crime scene periods to the point where I was having accidents in my clothes. I was having accidents in my bed. I was bleeding on the floor, trying to run to the bathroom, bleeding on furniture while we're having dinner. It was humiliating, embarrassing, and just my confidence and mental health really did take a toll. Again, I went back to my gynecologist saying, hey, we took the IUD out. We tried the birth control pills again. I'm still bleeding 3 times a month, 3 weeks a month. What is going on? There has to be something else going on. These periods are horrific. I've never bled like this before. And finally, she said, well, come on into the office. Okay, we're going to, do another exam, and we'll do another ultrasound on your uterus to see what's going on. Well, I'm lying there with the ultrasound technician, and she's saying, here's a fibroid. Oh, there's another one. Oh, there's another one. Oh my gosh, they're like rabbits. I'm so confused. I was speechless. I'm like, are you kidding me? You're telling me I have maybe 10 fibroids that are in my uterus right now? And she's like, oh yeah, they're all over the place. Speechless. So I go back to visit with my gynecologist, and she says, wow, I cannot believe that you have grown so many fibroids since your last, your surgery 3 years ago. Like, this is, wow, I'm so in shock. I said, yeah, me too, because I had the surgery, 3 years ago thinking that I would be okay, so what do we do? And so she suggested that we do a procedure where they go into the vagina with a camera. They expand the uterus with saline fluid to explore to see if there's anything within the cavity of the uterus that could be causing me to bleed so heavily. So I said, okay, let's do that. And she said if there was anything in the cavity of the uterus, that she would proceed to remove or partially remove it. Well, yes, there was something in the cavity, and she removed the fibroid that was causing a lot of heavy bleeding. And for some time, maybe a couple of months, I was okay. My cycles got lighter. I wasn't having as many accidents. So I thought, all right, well, let's proceed on with life. Things will be fine now. Like I said, within a few months, the bad periods were back. Again, having accidents in my clothes, to the point where one day at my job, I had to go to the emergency room because I was bleeding so heavily and getting lightheaded and just feeling anemic. Again, I go to her, I'm like, what is going on? I've had this abdominal myomectomy surgery. I've had this other surgery where you went inside to remove a fibroid. Why am I still bleeding? And she looks at me and says, Shayla, I don't understand you've done your research, but, I know as much as you know. We can try another birth control pill. And I said, no, I'm taking birth control pills and it's not working. I'm still having accidents and bleeding heavily. So no, I don't think that's a good option. So we ended the conversation that day, and she left it to me to make a decision on what I wanted to do. And I decided to come off of the birth control pills. I was done. Why am I taking these pills that aren't even working? And at the time, I didn't want to have children. And, I understand that the purpose of birth control pills were to keep me from getting pregnant, to plan our pregnancy. But I was to the point where, hey, I would rather have a baby than to be bleeding 3 weeks out of a month. Coming off of birth control pills definitely helped in terms of the regularity of my cycle. I was only bleeding, 1 week out of the month versus 3 weeks out of the month. However, I was still miserable, having accidents. The bleeding was heavy. The pain was intense. getting no relief, tired all of the time, always tired, always needing to take a nap. And my husband always used to joke around and say, you know, you're always so tired, you're always so tired. And I would just always say, oh, it's just because I'm, you know, tired from work. And then he's like, no, but you're tired more than usual. And, you know, I just lost my confidence and didn't feel sexy anymore. You know, I couldn't have sex as often as I wanted to. So, you know, there's that. You know, I wanted to please my husband, and, you know, if I'm bleeding so heavily all the time, it's, you know, almost impossible. And during the times that I'm not bleeding, I'm feeling tired and fatigued, and my sex drive is low, and I just can never seem to get my energy back. Nothing I could do to get my energy back. And at this moment, I just started going online and researching other options. I came across embolization, or uterine fibroid embolization. I remember my gynecologist in the past saying that was an option, but not for me, because I desired fertility and I wanted to have kids in the future. And she said that if I had that procedure, I would not be able to have a child. So, of course, back then I thought, no, I don't want that. But, you know, now that I've learned more about this procedure, it's actually very safe in terms of fertility. And in fact, compared to the open myomectomy I had, fertility is very comparable. And I decided to make an appointment with a specialist, an interventional radiologist who specialized in treating fibroids non-surgically. I made a consultation. At that time, we discussed all of my issues, my heavy bleeding, my pelvic pains that I was having, my low energy, and my urinary frequency, you know, having to go to the bathroom every hour on the hour. And that's when I learned that this procedure actually was safe for me. And I decided to proceed with it in hopes to find relief, because I know I didn't want to have surgery again. I've already had 2 of those surgeries, so what do I have to lose?
Shayla's story is unfortunately all too common. Up to 80% of African American women will suffer with these benign tumors. They cause 3 main symptoms. First, they cause very heavy menstrual bleeding. In fact, it's the #1 reason why women have heavy periods. 2, pelvic pain, which can radiate throughout the pelvis and abdomen into the back. And 3, increased urinary frequency and causing women to wake up at night. She was never told about uterine fibroid embolization, and that's very common for a lot of women. And women really need to know all their options. They're entitled to know all their options, not just the surgical ones, but uterine fibroid embolization, which is a non-surgical outpatient procedure. Patients will come into the Atlanta Fibroid Center. The procedures are done in the morning. It will take roughly 30 minutes or so to do the procedure. The patient has a 4-hour recovery in our center and is discharged home the same day. The procedure is done with conscious sedation, meaning IV and local anesthetics. There's no general anesthesia like an operation. So it's much safer than surgery. It's much less invasive than surgery. The recovery is much shorter. Once patients are discharged from our center, they have a typical recovery of about 5 days. So I'll tell patients, anticipate being off work for a week, but a lot of our patients are working sooner than that. You may be wondering, why do African American women disproportionately suffer with uterine fibroids? Well, I wish we knew where fibroids come from. We don't yet. But once they arrive, they grow with estrogen. That's why they can grow sometimes very rapidly when a woman is pregnant, and why they tend not to be an issue for most women once they enter menopause. Estrogen is stored in fat, and if you look racially at body fat distribution, African American women have more body fat than Latino women, Caucasian women, and Asian women have the lowest body fat. That's also the incidence of fibroids. Now, that's not the whole story, but it certainly contributes. There is also a genetic predisposition. African American families genetically have more fibroid incidence than other racial groups as well. But currently we can't pick our parents, so while we can try to do the best things as far as limiting our excess body fat, that's where the focus should be. So exercise, try to lose excess body fat, try to be as close to your ideal weight as you can. Eating well, eating colored fruits and vegetables. They have what are called flavonoids, which block an important enzyme in estrogen production. Try to limit estrogenic foods. There are a lot of hormone-rich foods in the food supply, and if you can eliminate them or at least cut down on their consumption, that will also help your fibroid symptoms. And the big offenders are red meat, non-organic chicken, dairy. Lastly, vitamin D is really important. Only 10% of African American men and women have adequate vitamin D levels. And it has to do with pigmentation in the skin and how we get adequate vitamin D. And vitamin D is a very powerful fibroid growth inhibitor. So if you can keep an adequate vitamin D level, your risk for fibroid is a lot lower. So eating healthy, exercise, lose excess body fat, and make sure you have adequate vitamin D. Compared to surgery, UFE is safer than an operation. It's less invasive. The recovery is much shorter, and you get to keep all your parts. It doesn't require a hospital stay. The risks of the procedure pale in comparison to the risks of an operation. Patients are literally discharged the day of the procedure with just a Band-Aid. That's it. So to summarize, UFE has three important strengths. One, it has a very high success rate. The success is over 90%. So therefore, 90% of patients will get the relief they're looking for. That's very important. Second, they avoid the risks and long recovery of an operation. A lot of the surgical procedures are done open, meaning the patient is literally cut open, either horizontally, hip to hip, or vertically from breastbone to hairline. The recovery for these surgical procedures is 2 months or maybe even longer. The recovery for a UFE procedure is on an order of 5 to 7 days. So it's significantly less. There's no operation, no risks that you would see with a surgical procedure. So it's safer, it's less invasive. The recovery is much shorter, and importantly, a woman gets to keep all of her parts.